Hi, everyone. Thank you so much for joining. I'm sure we'll have a few stragglers coming on, but I do want to go ahead and start and introduce you to Dr. Jennifer Landa. Jennifer Landa will be our host tonight. She is the Chief Medical Officer of BodyLogicMD. She is the owner and operator of BodyLogicMD of Orlando. Dr. Landa is OBGYN and is board certified integrative medicine with extensive training in anti-aging and regenerative medicine. Dr. Landa, take it away.
Thank you so much, Deb. Good evening, everybody. I'm so happy you're here with us. I am super passionate about this topic. I've been practicing this type of medicine for 20 years, but now I'm finally a menopausal woman myself. And I've been passionate about women's hormones for a very long time and one of my missions really in life is to have menopausal women understand more about menopause, about the problem that we have if we don't have our hormones. Besides the hormones, the problems that you feel, the other problems that are going on inside your body silently, which I think is one of the biggest problems that we have as menopausal women. So without further ado, I'll jump into the presentation. So in the webinar, we're going to cover menopause and why I consider it to actually be a problem, a medical problem, and why bioidentical hormones are safer than non-bioidentical hormones, because I'm sure a lot of people have told you that hormones aren't safe for you. Maybe even a GYN has told you they're not safe for you, and surely your friends and relatives may have told you that hormones aren't safe and you've read it in newspapers. So we're going to talk about the difference between some of the traditional hormones and why bioidenticals are different and why they're safer. We're also going to talk about whether you should consider bioidentical hormone replacement and what the treatment options may be. So first, let's talk basics. Menopause is the time when estrogen and progesterone secretion declines in the body. Medically, people ask me, sometimes women have asked me, well, am I menopausal? When am I going to be menopausal? The bottom line is it's a year without periods. So you can tell me if you're menopausal. But the tricky part is that the process can start up to 10 years prior to your periods going away. And that, of course, is the perimenopause. And that perimenopause, as some of you I'm sure on the call know, can really mess with your well-being. Basically, bottom line, it causes hormone imbalance and it can cause all kinds of problems. And honestly, I know from what I speak because I started having hormone problems at the tender young age of 28. And that's what sort of drove me to look for solutions in my own life. And as an OBGYN, I actually found I didn't have solutions to solve my own problems when I was only 28 years old and had hormone imbalance. And that's what my own problems are really what drove me to look harder at what hormones were, how they worked, and how we could boost and balance them when necessary. So what are the symptoms of menopause? I know you know that hot flashes are definitely one of them, but you may not have known some of the more subtle markers, hallmarks of menopause, like joint pain. I've had so many patients be so surprised that when they went on hormone replacement, their joint pain went away. And they said, oh my gosh, I had no idea that had to do with hormones. Of course, wrinkling, thinning skin, and even itching of the skin. And of course, changes in your memory, your mood, your sexuality, your moods, I was mentioning moods, anxiety and depression. And of course, that dreaded belly weight gain, right? We're going to talk a little bit about that in a few minutes as well. So first I want to talk about hot flashes though. And I want to talk about the fact that hot flashes are really your body's alarm. It is your body's alarm bell telling you things are not right in here. Something's wrong. Because when you lose estrogen and progesterone, you lose a lot of functions that are happening in your body. And over the last 10 or 15 years, a whole bunch of studies have been done that have shown us that hot flashes are associated with medical problems. So women who have more hot flashes have higher blood pressure, higher cholesterol, more diabetes and insulin resistance, more incidence of heart disease. They have changes in the brain sometimes that are associated with Alzheimer's disease and other brain diseases, and of course, osteoporosis. And that's because the hot flashes are basically caused by declining estrogen. And all of these things have been associated with declining estrogen, which is why we see these medical problems more often in women with hot flashes. So I really want you to be aware of the fact that some medical problems, some of the most common medical problems that people go to doctors for, might really be hormone problems. For example, migraine headaches. That one sometimes can very easily be treated with hormones. I have patients who've been seeing me for 15 years who haven't had a migraine since they went on hormone replacement. It's pretty incredible. And I think the number one, of all on this list that I want to highlight is insomnia. Women, when they lose their hormones, they don't sleep well. And when you don't sleep well, that changes everything. I'm sure everyone in this call who's had a really bad night of sleep has been cranky and irritable the next day, unable to concentrate, your memory stinks, and you just feel blah and like crap, and you really can't wait to go to sleep that night. Well, of course, this happens to menopausal women night after night after night. They really start to lose it. They get irritable, they get, can't remember things. And there's all of these other problems that occur as well, that are things that you go to see your primary care for, and you sort of chalk up to aging. A lot of people chalk these problems up to aging, but they might really be due to hormone problems. So the dreaded belly fat, I told you we would talk about that. So now there have been some great studies done that show the woman on the left has good levels of estrogen and progesterone, and the woman on the right is a menopausal woman who lost her estrogen. And when you have a lack of estrogen, you start to gain more belly fat. And when we talk about belly fat, it's not just that it's unattractive. The belly fat is fat that develops around your organs, like your liver in particular. You may have heard of the term fatty liver. Well, that increases when women lose their estrogen, and it's dangerous for their health. And of course, nobody likes gaining fat around their middle either. So even more basic, what are hormones? Because I think there's a lot of confusion about hormones out there. People think hormones are all kinds of things, but what hormones are your body's messengers. They take messages from one place to another. So this is a picture of the brain secreting hormones that act on the ovary, which is that little thing in the bottom if you don't have your reading glasses or can't see it. So the brain sends hormones to the glands like the thyroid, like the ovaries. And then the ovaries send hormones back to the brain. So it's a way that our body's organs communicate with one another. And the receptors on hormones are important too. It's important because hormones bind to receptors, and the hormones need to be exactly in a certain configuration to match up with the receptors for them to work accurately. And that's one of the main differences between bioidentical hormones and the traditional hormones, which are not bioidentical. So what does bioidentical mean? Bioidentical means hormones that are exactly the same chemical structure as the hormones that are in our bodies naturally. And unfortunately, a lot of the hormones that are on the market that come from the traditional route, what I learned to prescribe as an OBGYN, things like Prempro, things that come from the commercial pharmacy, a lot of them are hormones that are not the same as what's in our body naturally. They might have actually come from a horse. That's where some of the hormones come from. And they might have just been created in a lab, and they're not identical to what happens in our body naturally. Because if they were identical, they actually can't be patented, and a drug company wouldn't be able to market them. So bioidentical hormones are exactly the same chemical structure as what's in our body naturally, so that those hormones have the identical effect to our natural hormones. And bioidentical hormones come from natural sources like yams and soy, and they can be compounded by any of the compounding pharmacies around. So it's a different type of pharmacy. So what are some of the benefits of hormone therapy? So like I said, I've been doing this for 20 years, both personally and professionally. And I've had so many women tell me that I've completely changed their life. And I've had families tell me that we've given them their mom back. I've had husbands tell me I've given them their wife back. And by the way, I see men too, and I've had the opposite comment. I've had women say we've given them their husband back, but we're concentrating on us ladies tonight. And what I see is an increase in energy, better sleep, better moods, better brain function, better memory, and better sexuality. I also see decreased risk of disease. I really have, I would say, a very healthy lot of patients due to their use of hormone therapy. And a lot of my patients tell me that they think they look younger than a lot of their friends, and they attribute it to their hormone use. So back to that abdominal fat. So we talked about having low estrogen and what that does to the belly fat. Well, what's really interesting is that HRT, hormone replacement therapy, increases lean body mass, which is your muscle, and reduces abdominal fat and makes your waist measurements smaller. So that means there's a reduced risk of what they call metabolic syndrome. So I told you how that belly fat is actually very unhealthy for us, unhealthy for your liver. Well, it's also unhealthy for your heart. And metabolic syndrome is basically when your belly gets bigger, and that belly fat is creates a lot of inflammation in the body, and that inflammation acts on the heart, increases your risk of a heart attack. And there is a reduced risk of all of those things with hormone replacement therapy, as long as you're taking the right hormone replacement therapy. So what about the risk of going without hormones? Some of you may have heard of the Nurses' Health Study. It's one of the largest studies of women, almost 30,000 women. And many, many women had their ovaries and uterus removed for benign disease. And what they showed in the study was that the women who had their uterus and ovaries removed had a higher risk of dying from anything, and of having a heart attack, and even having lung cancer. So there are a lot of benefits to our natural hormones, and going without hormones can be risky. And that of course is what's happening once we go into the menopause. So as I've kind of alluded to before, bioidentical hormones are not the same as the artificial hormones. The traditional hormones that I was taught to prescribe as an OBGYN actually increase the risk of breast cancer. It's totally amazing to me that they're even still on the market, but they are. And bioidentical hormones do not increase breast cancer risk, which is the biggest difference I can probably name, and the most reassuring. So what about the effects of estrogen? Estrogen controls 400 functions in the female body. I know that's like an amazing number. And the thing that you really need to think about is what happens to those 400 functions when we lose almost all of our estrogen when it comes to menopause. We really have not quite undetectable, but nearly undetectable levels of estrogen when we're in the menopause. So all of those functions cease to function. So what do the studies show? The studies show that estrogen is associated with a bigger brain. Women with lower estrogen actually they've done studies and they've shown that the brain of women with lower estrogen actually shrinks. And the lower levels of estrogen due to removing the uterus and ovaries also led to smaller brain volumes. But what they've shown is women who use HRT, hormone replacement therapy, have bigger brains than women who've gone through menopause and who have not used hormones. And that's a pretty new study. This is pretty new information, but that's what we're starting to see. What about estrogen in the bones? We've known for a long time that estrogen is really good for bones and reduces the risk of osteoporosis because we lose the most bone we're going to lose between the first and fifth year of our menopause. And it's so significant that in this study published in Osteoporosis International, the authors said that they proposed that hormone replacement therapy should be considered for the primary prevention and treatment of osteoporosis. Now, that's different than what most doctors are doing these days, but it makes a big difference. It can actually, I've seen it many times in my practice that estrogen replacement therapy and hormone replacement therapy will help grow bone back in women who've lost bone. What about the heart? I alluded to it before. Now, it's important to remember that cardiovascular disease is the #1 cause of death in not only men, but in women too. And estrogen treatment reduces the risk of plaque in the arteries and the risk of a heart attack. And as you can see, that's fairly new literature too from 2020. And we've known it before. There have been many, many studies that have reconfirmed this over and over and over. But interestingly, it's only frequently when bioidentical hormones are used. And one of the things that they've shown in some of the studies is that it's better when the estrogen is started earlier in your menopause, which is another one of the reasons I want women to realize that the alarm bells of hot flashes are important. And losing estrogen changes things like your brain, like your bone, and your heart. What about vaginal dryness and what we call vaginal atrophy? The vagina and uterus on the right, well, actually, that's the uterus, the ovaries, and yes, then the vagina towards the bottom. As you can see, every tissue in here has shrunk on the right as compared to kind of the plump, juicy tissue on the left that has its normal complement of hormones. That's what happens. Some of you may have even experienced it. It's incredible to me that as women, we don't talk about this more. The fact that your vagina gets thin and dry and shriveled up and cracks and hurts when you have sex once you go into menopause if you're not using hormones. Some women get by okay using lubricants, and that's fine, but some women find it really, really difficult. And this is honestly one of the easiest things to fix with hormone replacement therapy. And one of the most satisfying. I've had so many patients tell me that they're so happy to be back in the saddle again, so to speak, and to be able to be intimate with their partner again due to hormone replacement therapy. So what about cancer and estrogen? Because that's one of the things that has been talked about so much in, the news media. And like I said before, the non-bioidentical hormones, the traditional hormones like specifically Prempro, were linked to an increased risk of linked to an increased risk of breast cancer. Absolutely, and for sure. But that is not the same as bioidentical hormones. Bioidentical estrogen, specifically estradiol, which is our main estrogen, has been proven to improve the cholesterol profile, lower the risk of cardiovascular disease, slow the rate of bone loss, improve the brain, and even prevent colon cancer. And bioidentical estradiol has not been linked to breast cancer or cancer of any kind. So what about progesterone? Progesterone is the unsung hero, I would say, of hormones, because progesterone helps balance the effects of estrogen. That's what its normal function is, but it has a calming effect. It improves our moods and it helps us sleep. one of the most important things it does is it helps us sleep. And of course, that has a good effect on your brain, on your mood. And it actually has lots of other positive effects medically in terms of blood sugar, thyroid, your nervous system. And we'll go over a couple of those. So there are beneficial effects of progesterone on the heart. And these have been known for a long time. Progesterone decreases the bad lipids like LDL, your cholesterol, and progesterone decreases blood pressure, decreases plaque in the arteries, and it helps our hearts be more healthy. What about our brain? Progesterone actually breaks down to something called allopregnanolone. And that allopregnanolone has been shown to have incredible effects on the brain. It can be calming. It can be good for reducing the likelihood of things like Alzheimer's. They've done lots of studies of progesterone that shows that it's protective in terms of Alzheimer's, in terms of stroke, and even traumatic brain injury, because progesterone increases something called brain-derived neurotrophic factor, which is BDNF. Little too detailed maybe, but the bottom line is progesterone helps grow brain cells, and it's really healthy for our brain. And when we're in menopause, we have very little progesterone. Now, there are artificial versions of progesterone that are included in birth control pills and a lot of the menopause hormone replacement. And the artificial progesterones have all kinds of negative side effects like you see here: mood problems, acne problems, even trouble sleeping, breast tenderness. But natural progesterone, bioidentical progesterone, does not do that. Like I said, it helps with sleep, it's calming, it actually helps get rid of extra water that you might be holding on to, increases metabolism, which of course helps with weight, and it helps with mood. So what about testosterone? Testosterone is truly incredibly important, and most gynecologists are told to stay away from it with their patients. But I will tell you, back when I was 28 years old, low testosterone was actually the big problem that I had. And so testosterone is probably, I would say, become my favorite hormone, because I've been on it since I was in my young 30s. And that's a good 20 years now. I'm almost in my mid-50s. Well, I am in my mid-50s now, actually. Believe it or not, women have more testosterone than they do estrogen in their bodies. So that is obviously, Mother Nature obviously thought it was very important to give us lots of testosterone. And we produce it from our ovaries, and we produce some from other tissues too. So actually, women don't lose all their testosterone in menopause. They just lose it slowly as they age. And testosterone is incredible for energy, memory, mood. It helps build muscle, helps us lose fat, helps protect our bones. It has a lot of great functions. So what are some of the symptoms of losing your testosterone? Some of them can actually be really subtle. Of course, there's, gaining fat, losing muscle. But some of them are more subtle, like lower self-esteem, trouble making decisions, just not feeling like everything's right with your world. And testosterone incredibly does make you feel like things are more right with the world, which is a good feeling to have. And it does some of these other things that you see listed there as well. So what are the causes of low testosterone? Well, there are a whole bunch of them. And I mentioned aging. And you might be sitting there going, well, she said she was 28 and she had low testosterone. What was up with that? It was birth control pills. Believe it or not, in some women, birth control pills can cause really low testosterone levels, and even statins. So medications are a big cause of low testosterone, but just aging itself does cause lower testosterone, and also stress. A lot of stress in your life can cause your testosterone levels to go down. And this is for both men and women, by the way. So what about testosterone replacement therapy? What does it do? So like I said, I've been on it since I was about 33, I think, is when I finally realized that that was my big problem. And that's why I changed my whole practice and really stopped being an OBGYN and really just have concentrated on hormone replacement therapy ever since, over 20 years now. And testosterone increases energy, it improves your mood, it improves muscle strength, reduces body fat, and of course, increases sexuality. It improves our desire to want sex, it improves our lubrication, and it has a wonderful antidepressant effect. Like I said, it makes you feel like everything's right with the world. So if you wanted to do hormone replacement therapy, or even if you didn't, I think one of the most important things to do is to measure your hormone levels. And interestingly, it wasn't something I was taught to do as an OBGYN, and most OBGYNs don't want to measure hormones. And even when they do, they mostly measure with a regular blood test. And the companies that do the blood tests, like Quest and LabCorp, they have very, very broad ranges of what's normal for a woman's hormones. And when a doctor isn't trained in hormone replacement therapy, they just accept those levels. That's what I did when I was young in my career and learned about hormones. We just said, okay, well, if Quest says it's normal, then it's normal. But that's not necessarily the case. And that's why specialized hormone testing can be very helpful. So I've used urine testing, saliva testing, and blood testing. And I do like blood testing, as long as you know what the correct ranges are for your patient, or as long as you as a patient gets educated and knows what the correct levels are, but that can be challenging. But I do think it's important to get your hormones measured before you do therapy and as you do therapy, to make sure that the treatment is having the right effect and that your hormones are balanced and that they're where they need to be, and also that they're not too high. You want to make sure of that. I've seen some hormone replacement doctors who say that they can do it all based on symptoms, but I honestly don't agree, because just as an example, hair loss, there are 5 different hormones off the top of my head that I could say might cause hair loss. So I can't tell unless I'm checking. And I think that's a really important part. I wish, as a matter of fact, that we did hormone testing like in our 20s, when we feel great and have great hormone levels, and then we'd know what to set them back to. But that's generally what we're doing when I do hormone replacement therapy. I want to bring your hormone levels back to what they might have been when you were in your 20s or 30s. So bioidentical hormone replacement therapy, like we said, it comes from compounding pharmacies, originally from yams and soy, and then compounding pharmacies can make them for our convenience into creams, gels, injections, patches, pellets. Those are all great ways to deliver hormones. And those are the ways that I use in my practice with my patients, and actually also for myself. Well, it's been great talking to you all about hormones tonight. I hope that you got some new information, maybe learned some things that you were interested in. And if you have any questions, we'd be happy to stay on and take any questions that you might have.
Thank you, Dr. Landa. That was very informative. Yes, we already have some questions that were posted in the chat. Let's see. One woman's asking, I'm still waiting on the increased sex drive part. It sounds like she's on therapy, but the sex drive is taking a while and she's super frustrated, wants to know how long that would be.
Oh, so like I said, I've had my own personal hormone problems since I was 28. And the biggest problem I had was actually sex drive. And that caused me to write a book about 10 years ago called The Sex Drive Solution for Women, because women's sex drive is complicated. And it can be more than just hormones. It can be multifactorial. And one of the most common reasons that I see, it may or may not be your reason, but one of the most common reasons I see can actually be relationship issues. And it's funny, because a lot of my patients will tell me, no, my relationship's great. I love my husband. He's a great guy, and this and that. But one of the things at least that I experienced in my relationship, and I've seen in a lot of my patients, is that as very highly competent women, that I know a lot of you are, we tend to take on a lot of stuff in our lives, and we do a lot for people, and I would say, overdo. And sometimes that leads to some relationship dynamics that can cause some resentment, because we're busy running around doing everything for everybody else and nothing for ourselves. And when our own cup is not full, it's really hard to want to give sexually to somebody else and to engage sexually with somebody else. And especially at times, somebody that we're taking care of in a way that we feel like is maybe a third child, a fourth child. That may or may not be your situation, but I would refer you to, even though my book is old, it's an oldie but a goodie. And it talks a lot about the reasons that might be behind women's sexual problems.
Thank you. Is there a specific diet for menopausal women?
That's a really interesting question. One of my colleagues, Dr. Sarah Gottfried, who is an amazing OBGYN hormone specialist in her own right, she is actually researching and coming out with a book about that shortly. So watch out for her and her book. And she's released lots of books, so she's got lots of interesting ones to read. I would say that generally the diet that I recommend, if I had to pick a diet book out there that it's closest to, would be Mark Hyman wrote a book called The Pegan Diet. P as in like peas that you eat, PEA, like a pea that you eat, GAN. So it's like vegan, but paleo. And so that's a weird combination. So you kind of have to read the book to figure it out. But basically, I recommend a diet that's really non-processed foods. That's a big thing to stay away from, staying away from processed foods, anything that comes in a bag, bottle, frozen, etc. And to try to stay low sugar, low carb, and to try to eat a lot of plants and good fist-sized portions of lean meats, proteins, fish, things like that. I hope that's helpful for you.
How long do you recommend staying on HRT?
Oh, such a good question. Thank you for that question. Okay. So, when the data came out about hormone replacement being bad or dangerous, the Prempro in specific causing an increased risk of breast cancer, they started to say, well, you should only be on hormones for the shortest amount of time possible. And then doctors started to think 65 was this cutoff. But I will tell you, the American College of OBGYN published in their guidelines back in 2014 that we no longer have to limit hormone replacement therapy, and that we should individualize the therapy depending on each woman and the benefit that she's getting. I've had so many, I can't even tell you the number of women I've had who've told me when they took me off hormones, my life ended. Or when my mom was taken off hormones, because this data, the bad hormones, Prempro, that happened 20 years ago. So women will tell me when my mom was taken off hormones, oh my God, she lost her mind, and it was terrible. And so there is no limit. That's the answer. The answer is there is absolutely no limit. I think I will be in hormones till the day I die, which will hopefully be at a very ripe old age. I had my mom unfortunately passed young, but she was on hormones till she was in her 70s. And she wasn't healthy in a lot of other ways, unfortunately, but that's a whole other story. But I truly believe women should be on hormones forever, because, like I said, hormones decrease your risk of disease and make you feel better. When would you want to stop feeling better and have an increased risk of disease? Never. It doesn't make sense to take women off, if you ask me.
I love this next question. I'm 70 years old and I believe this can help me. Is this true?
That's another good question. So yes, the answer is it is true. I have treated a lot of women in their 70s, and now I have some patients in their 80s, which is pretty cool, actually. So yes, we can start women on hormones at any age, but there were some studies that were done that showed that hormones in older women weren't good. But again, that was in those traditional hormones. It was specifically Prempro was shown not to be good in older women. When they did the same types of studies in older women with bioidentical hormones, they showed no detriment. They also show, I will say, not as much benefit in terms of heart disease and in terms of bone disease, but there's still great benefits. Like I said, I have patients in their 80s who are happily taking their hormones and have seen great improvements.
Excellent. This is a good one. What type of workouts, weight training and cardio do you suggest to supplement HRT to aid in weight loss?
That's a great question. So my answer is sometimes it's a little nuanced and it depends on how a woman feels. So if you're not on hormones and you're just exhausted, completely exhausted every day, I would not recommend hitting it hard with exercise. You've really got to deal with the sleep and the fatigue and things like that. But if you're on hormone replacement therapy and you're feeling good, then I recommend a combination of weight of resistance training, let me say. So I do a lot of yoga. I do a lot of body weight exercises. And I love the idea of weight training if you're happy with weight training and if you don't feel like the weights are putting too much stress on your joints and things like that. But resistance training, challenging your muscles is definitely an important part of what you need to do. And then the cardio is an important part too. We do need to kind of do that traditional old burn the calories type of thing. And so I would recommend, let's say, 3 to 4 days of cardio, 30 to 40 minutes of cardio, and then some resistance training as well, like 3 days of resistance training, a good, balanced body workout. Now that all said, one of the things that's very interesting that can shortcut sort of both of those is HIIT training or high intensity interval training. And I do like high intensity interval training if you're in the shape to do it and if your joints can take it, because some of it includes jumping, and I don't know that I'd really recommend jumping as a big part of your exercise routine because it's not so easy on your joints, like your back and your knees. And I'm finding that as I get older, I have to tailor some of those things back. So it definitely has to be a combination, and HIIT training has been shown to kind of be that combination and provide results in a shorter period of time. So I know that was kind of a long answer, but I hope that helped cover it.
Thank you. Okay, we've had a couple of versions of this question. BHRT, is it okay for breast cancer survivors?
That's such a good question. So, I would say that it depends on the situation. So it's definitely something that needs to be individualized with your individual practitioner. I'm not saying that it's not appropriate. It can be. I would say that to some extent, it depends how far out you are from the breast cancer diagnosis. It can depend on things like receptor status and all kinds of other things. So there's a lot to be individualized, but it is not out of the question at all.
Let's see, on average, how long does it take you to level out once you start HRT?
Oh, that's a good question too. So I usually warn my patients that all HRT is not necessarily a slam dunk. Hormones are very subtle and very individualized. So right when I'm meeting a patient, I don't know how they're going to process the hormones. So I have to, make an educated guess based on their levels and their symptoms, how much hormone of each hormone they're going to need. But then that's why we do follow-up testing and visit in about 3 to 4 months after going on hormone replacement therapy to try to balance things out and get them right and dial them in. So I tell patients it can take even up to a year for me to really get you to where I want you to be. but I would expect in that year that you would be improving all along.
Excellent. This is a good one too. You're getting some great questions tonight.
This is awesome.
I am post-menopause. Will this help me?
Yes. So, post-menopause, it definitely helps to replace your hormones. The question in some respects can be how far post-menopause. So that question kind of harkens back to the question of the woman who said she was 70. On average, a woman's about 50, 51 when she goes into menopause. So I was addressing somebody who may be 20 years into their menopause. And yes, I absolutely think hormone replacement therapy can help women who have already gone through the menopause transition even many years ago. But like I said, one of the things that they've shown in the literature in the past 10, 20 years is that the younger you start your hormone replacement or the earlier into your menopause, possibly the greater benefits you're going to have with like your bone, your brain, your heart. But I have started many women on hormone replacement therapy that have been in their 70s, let's say, and they've gotten great benefits. And I have some of those women in their 80s still continuing hormone replacement therapy. So it's never too late, basically.
Okay, great. So then I'm going to add on to that. Somebody was asking about the perimenopause phase. Are hormones okay? So you're getting it from both ends.
Yes, this is great. This is great. So like I said, I've been on hormone replacement therapy since I was 28 years old. And that was for hormone imbalance. And interestingly, some of my hormone levels at 28 years old actually looked like perimenopause, which is crazy. Like, how can that be? But it can. So women can have hormone imbalance at any stage of the game. And women's hormones can look perimenopausal even when they're much younger. And perimenopause, absolutely, you're a candidate for hormone replacement therapy. Sometimes you only need progesterone. Sometimes you only need progesterone and testosterone. And then sometimes you need all three. But the odds are when you're in perimenopause and you're having symptoms, the odds are that your hormones are out of balance and you're missing some of those essential functions that we said estrogen and progesterone and testosterone have in the body.
Makes sense. Okay, someone posted, you look like you're 25. I think that you like that.
I love that, but my 23-year-old son would probably be horrified to hear it. And my 21-year-old daughter. Actually, I've been accused on rare occasion of being my daughter's sister and my son's girlfriend, which was pretty cool.
Yeah, absolutely.
But you're not looking closely enough at my wrinkles.
No, don't say that. Okay. So there's a lot of versions of this question. People very frustrated with belly fat. So I'll ask this particular one, but I think this will address quite a few of them that have come in. I'm very athletic, and the last 2 years has been a total disaster. I can't seem to run or lift as much, and no matter what I eat, my belly fat does not go away.
Right. Yes, we have so many women who are frustrated with the same thing, which is why I'm sure there, like you said, Deb, there are many questions. So the hormone changes, like lower testosterone, lower progesterone, lower estrogen, all three of those. So whether you're perimenopausal or menopausal or postmenopause, those are all problems that you may be having. And those problems, each one of those hormones individually will contribute to increasing body fat and decreased strength. I've participated in a lot of athletic things myself. I've done some half marathons and some triathlons and treated a lot of patients in that athletic arena. And hormone replacement truly does make a big difference. One other note for athletes, sometimes the stress system can play a role too. So there can be issues with cortisol and insulin And those are issues that we can address. And thyroid also, those are issues that hormone specialists all look at and address. And it could be really any of those hormonal problems that might be contributing to your gaining the belly fat and losing the strength and the power that you're experiencing.
Okay, great. Let's see. What is the main difference between a bioidentical estrogen patch from a gynecologist, and this is a great question too, and an estradiol patch from a clinic such as yours? Is it dosage variation, availability?
There's actually no difference whatsoever. If you are getting an estradiol patch and it says just estradiol on it and pretty much nothing else other than estradiol, it is a bioidentical estrogen patch. And I do prescribe the estrogen patch to some of my patients that you can get at your regular gynecologist, and that's just fine. The issue comes in is, are you getting bioidentical progesterone with that? And is testosterone needed? And, is that being prescribed as well? But the answer to your question is the estradiol patch from our clinic or any other gynecologist, all the same.
Excellent. Excellent. Okay. A couple more questions and then.
Let me clarify one more thing. Sorry.
Okay,
And that's an interesting point to clarify, that not all traditional hormones that come from CVS or Walgreens, not all are non-bioidentical. Some of them are bioidentical, not a lot of them, but the estradiol patch is a really good example of a traditional hormone that comes from CVS and Walgreens and is bioidentical. Thanks.
Okay, good to know. Thank you. Okay, this is a question on troches. We've had a couple of them. Thoughts on HRT as troches that dissolve in the mouth versus pills and creams. Can you state any pros and cons?
So it depends on the hormone, but generally I'm not as big a fan of troches as I am hormones that go, well, in terms of estrogen, let me just start there. Because every hormone, estrogen, progesterone, testosterone, and then others, thyroid and otherwise, has a different delivery system that is best. And one of the things I don't really like with estrogen is using estrogen through the mouth, because when you use it by mouth as a pill specifically, it's been shown to increase the risk of clotting. And the problem with a troche is that some of it is absorbed into the blood system, into the bloodstream under the tongue right away. But then at least 50% or so has been shown to be swallowed. And then you're getting oral estrogen. And that's not as healthy as getting estrogen through the skin or in the skin, like a pellet or a patch or a cream. So those are the ways that I prefer to prescribe estrogen specifically. But progesterone, for example, by mouth is great. And so a progesterone troche might be perfectly reasonable. I don't tend to prescribe them myself, but it would be reasonable. And testosterone troches as well are fine.
Excellent. Okay, we have a couple of questions regarding costs, insurance. I'm not going to go into too much detail. I do want to let you all know that we have a couple of wellness advocates standing by tonight to receive any phone calls you may have. And the phone number is posted, it's on the screen. It's 877-846-9009. Again, that's 877-846-9009. But these ladies are also available between 8:30 a.m. and 6 p.m. Monday through Friday, Eastern time. If you don't want to call, or if you feel too shy with your questions, you can also email them at wellness@bodylogicmd.com. And they'll be able to better answer questions regarding costs, because it will all depend on the practitioner and what area you're in. But generally, our initial consult, so that would be your first consult with one of our practitioners, is going to range somewhere, between $395 to $595, and that's for like over an hour consult. And then follow-ups generally range between $150 to $350. Quite a few of you have asked if for the labs, can you use your insurance? Sometimes for the blood work, yes. However, we do strongly recommend the urine blood panel the urine testing that Dr. Landa referred to. And that is something that physician's lab does not accept insurance, but the testing is extremely thorough and useful to the docs or practitioner for prescribing your hormones. Other than that, I think that we've answered as much questions as possible tonight. Dr. Landa, thank you so much for your time. And ladies, thank you, all of you, for attending. Such wonderful participation with excellent questions. We really appreciate it.
Yes, thank you so much. It's been a pleasure to answer all your questions and have such an engaged audience. Thank you so much. Thank you, Deb.
Thank you. Have a wonderful night, everyone.
Thank you.